I have walked out on a pool deck and been like,
boy.
excuse me. And it didn't go over very well, so I didn't do that again.
No, I would love to have seen that.
Excuse me.
Welcome to Fit2B Radio. Slip on your minimal sneakers, notch your headphones into your ears, tuck your smartphone into your pocket, and take us along for a walk while we talk. Or just grab a cup of your favorite drink and get on the floor and stretch a bit while we bring you all things fitness, core, and diastases recti related.
Okay, I'm recording, guys, so don't interrupt me, okay? I love you, but don't talk to me.
Hey everybody, welcome to Fit2B Radio. My name is Chris Stacey. I'll be your host today. I've got with me Beth Learn. She's the CEO and founder of Fit2B Studio. We also have a guest I'm excited to talk to. Her name is Nicole Cozean. She's the founder of Pelvic Sanity, which is an actual physical clinic as well as a website with a lot of resources. Nicole's a pelvic health physical therapist. Nicole, thank you so much for taking some time and talking to us today.
Oh yeah, thanks so much, you guys. I'm super glad to be here and talking all things bladder.
Yeah, awesome. Well, I am currently recording this podcast with you guys at a coffee shop. So I am excited to see how it goes as I start talking about pelvic bladder and other interesting issues, what the looks I get around the coffee shop actually are. This is the first. I don't think we've recorded in a coffee shop before, Beth. I'm not sure, but it'll be interesting. Nicole, where are you coming to us from?
So my clinic right now, I'm coming in from my treatment room, and my clinic is in Orange County, California, in a little town called Laguna Hills. It's in Southern California. We've been around for about 2.5, almost 3 years actually, in April or May, and we're super stoked about it.
That's awesome. And so how do you like it there? How long have you been there?
So we've been there so it'll be 3 years in April, May-ish. And so we specialize exclusively in men and women with pelvic health conditions. That's why we named the clinic Pelvic Sanity. We kind of wanted to, we kept having, my husband actually runs some of the business side of the clinic, and I always would come home before we started, and I would always be like, man, this is so insane. Like, this person has that, and that person had to go through 7 doctors before they found me, and they're better in 4 visits, that kind of stuff. And so when we were bouncing around names and stuff, we were like, I didn't want to call it my own name, and we wanted to have pelvic somewhere very prominent in the name. So we decided to call it Pelvic Sanity, because that's what we hope to restore for people that come into our world. So
right.
That's awesome.
That makes so much sense. So you basically want to restore sanity to all pelvic issues.
Yes,
Mm-hmm.
for men
because
and
you
women
can feel crazy.
are not exempt from pelvic floor issues and core issues. So we treat both men and women, which is a little bit of a difference. I think a lot of pelvic health physical therapists, specialize in postpartum and stuff, which is awesome and great. But we wanted to include men in our practice as well. So
yes, thank you for doing that.
You're welcome.
Representing us. I appreciate that.
Yes.
Okay, so today we wanted to dig into something that I don't have any idea what it even is. So I'm excited to learn. I'm glad that you'll say it, because I'm reading it on my notes here and I'm just not sure how to even say it.
I'll be the judge if he does it better.
Okay, interstitial cystitis.
Okay, Chris.
And I'm going to be honest. Wait, Chris, now you have to say it.
Interstitial cystitis, which is cheating because you just said it.
Totally.
That's what business partners do. They give each other a leg up. I did not know anything about this until I saw a post by Nicole on Instagram and thought, wait, hold on. This is a pelvic health therapist talking about this. I thought that was a condition higher up in the body somewhere.
Yeah.
And so I did a little digging and realized she's the only one I knew of talking directly about it. So I reached out to her and asked her to be on the podcast because it is related to core pelvic bladder health issues.
Absolutely.
So what is it?
So good question. What the heck are we talking about? So here's the deal. So I think that, kind of along with endometriosis, interstitial cystitis is one of the most misunderstood and misdiagnosed pelvic health conditions around. There are many even like urologists that don't even quite know exactly what it is or the treatment protocol that someone should go through. So what it is the actual formal definition is a bladder pain condition. Actually, it's more of a pelvic pain condition where you have two main symptoms. Most people, urinary urgency and frequency, and some sort of pelvic pain right above the pubic bone. Now, the formal definition says that is the pain is perceived to be a part coming from the bladder itself. So, and then we can delve into a lot of that. So it's basically, it's also known as, it's also known as bladder pain syndrome, painful bladder syndrome. So you may have heard of it in those type of terms. But the formal name is interstitial cystitis, or we call it IC for short, but it has a ton of different names that go along with it. But it basically means urinary urgency frequency, some sort of pelvic pain or painful urination type of condition.
Okay.
What I read said that people often think they have a bladder infection, but there's no infection. They go to get tested for a urinary tract infection or a bladder infection, but there's no infection. And then they have this pain and their doctor's like, well, you're fine. Or here's some medication. Like when I looked it up, it was the cure or the treatment is all these meds.
Right.
So what's the role of physical therapy?
Yes, good question. Okay, so let's talk about the symptoms first real quick.
Sure.
Because, so you're right, most people either start with a UTI, a real UTI, like one that cultures actually positive for bacterial infection, or they think that they do, it cultures negative, or you don't have evidence of an infection, but you still feel like you have one. And so, and it lasts for a long time and it is relentless. And so it can be extremely, extremely painful, pretty debilitating. It causes urinary frequency, which means you go to the bathroom way more times during a day than the normal person or the average person. And then also it disrupts your sleeping because you're waking up at night to pee. And then it's also very painful. And this is where the pelvic floor comes in, because if anybody had to feel like they had a bladder infection, you instinctively are going to kind of hold. You don't want to pee, it hurts, your muscles contract, right? And so because of where the bladder sits in the pelvis, it literally sits right on top of some pelvic floor muscles. And so those muscles can get irritated, and then those muscles can irritate the bladder can irritate the muscles, can irritate the nerve, and then we have a unfortunate spiral of symptoms where it just like sort of piggybacks on itself. And so that is how some of the pelvic floor can be involved. Now, the interesting thing is that the more we're finding out about the condition, the more that we're finding out that it's much less of an actual bladder disease process than it's much more of a pelvic floor nervous system, and maybe the bladder is going on with that. So the pelvic floor muscles themselves, if they are, we'll call them dysfunctional, but if they're not functioning optimally, then they can also cause symptoms of urinary urgency and frequency. And as we all know, anything that can be a muscle spasm can also be in pain. And so then we sort of get into the discussion of like, oh, well, is it the pelvic floor, or is it the bladder, or is it the nervous system? And the reality is that it's probably a combination of all three things. But that's how the pelvic floor, and as we know, especially all your listeners know, that it is the setting for the pelvic floor is part of the core system, right? So it's literally the floor of your pelvis, and it's involved in pelvic stabilization, lumbar spine or back stabilization, right? So it's being used in all of that core stability stuff. And so that's sort of how those two things are connected. And that's how sometimes a pelvic floor that isn't functioning well can also create bladder symptoms. So it's not uncommon to have, feeling like you have to pee a lot if you do some pelvic floor exercises and stuff like that. So hopefully that makes sense.
And if you have Yeah, if you have those feelings, your pelvic floor muscles aren't functioning optimally. Like you said, they're connected to stability and spine support. They're connected to your frontal core muscles as well.
Yes.
It creates this chain reaction that does not feed well into exercising. Who wants to exercise when they have to pee every 15 minutes? Or if they're worried about leaking, or if their crotch hurts?
Totally.
That's no fun.
No fun. And then, yeah, go ahead, Chris.
Oh, no, I was just going to say it creates this you already kind of referenced this, but it creates a cascading set of problems because people are trying to adjust what they're doing to deal with it, which will just make it worse. So many things are like that.
Yeah.
Yeah. And then one of the biggest misconceptions about kind of any pelvic floor condition, and I'm sure you guys have talked about this on your podcast before, but, I think it's easy for somebody that has the problem, a bladder problem, maybe postpartum, to assume that those muscles are very loose, stretched out, and they might be weak, but they can also be very tight or trying too hard to do their job. Hypertonic, right? And so that's another thing where somebody with interstitial cystitis or any sort of bladder problem, that's why they really need to go get assessed by a pelvic physical therapist or take, some note as to whether your pelvic floor muscles are too tight, because they can also be weak in that way. And then the fix for that, right, is core strengthening, which, especially if you have a bladder irritation or interstitial cystitis, then the typical core strengthening exercises that everybody thinks of actually can irritate the bladder even more, because as we all know, like the big six-pack muscle, right, comes right down and attaches to your pubic bone, and that's right where your bladder is. And so anything that like contracts that, especially if it's overactive in that way, can irritate the bladder. So it's like, the thing that you think is starting to help is actually the thing that can be irritating symptoms if you have them. And so, so then, patients, it's frustrating for people to try to think that they're doing something good and they're trying to fix their core, and then, dang it, now my bladder symptoms are worse, or I'm peeing way more, or whatever. So.
Yeah.
So,
and where my brain goes, go ahead, Chris.
I was just going to say, so if you think about like the common symptoms for a bladder infection and for this, what are the differences that can help people kind of realize that it's not a bladder infection?
Yeah, that's actually a really excellent question. And to be perfectly honest with you, it's really difficult. And so that's why a lot of times we just really encourage people. Patients that have had this problem for a long time will start to be able to really tell the difference between an actual infection and I call it a phantom UTI, because it feels like it, but it's actually not an actual infection. So there's a couple tricks. Obviously the infection-based symptoms, right? If you have a really bad infection, you're going to have a fever, you're going to feel kind of icky as well. But most people, like the urgency, frequency, painful urination part is still there, whether you have an infection or not. So it's all about, there's some, self-test strips that you can do. A lot of times my patients that have interstitial cystitis will actually have like a standing order with their physician, so they can just go and do a urine test without actually having to make an appointment with their doctor to make sure. Because then the other thing is, you don't want to go on antibiotics if you don't actually have an active infection, right? So and that messes up your whole gut and all that stuff. So it's really important that's where a pelvic health PT can come in as well, to really decide and help the people figure out, like, if it's the pelvic floor muscles, if I can go intravaginally and feel pelvic floor muscles, and I can reproduce that same feeling of that UTI, and after we release those muscles, then those symptoms decrease or go away, then it's like, ooh, that symptom is tricking your brain, and it's actually muscle, but it's not, your brain doesn't know any different. And so that's why we try to sort of separate out what's real and what's not, coming from the muscles and nerves. So, but it's difficult. So you're right, it's tough.
So is there a broad awareness of this from pelvic floor physical therapists? Or I guess what I'm trying to ask actually is, if someone thinks that they might be struggling with this, is it going to be easy for them to find healthcare provider of some kind that's going to actually know what they're talking about? Or, you see what I'm saying?
Super loaded question, but here's the short answer is that I think that ultimately pelvic health physical therapists are kind of the great first start. And if you have direct access in your state, you can go directly to one of them first. The next best thing is to search for like a urologist or a urogynecologist that actually says on their website or in their office that they actually have expertise in treating that type of condition. Your GP is likely never going to have heard of it. And sometimes those people get a little bit confused with the UTI-like symptoms and, it's not testing positive, so I'm just going to give you antibiotics anyways. And then here's the other thing that's a little bit frustrating is that this is like one of the biggest misinformation things on the internet that I've ever seen, which is why I ended up writing the book about the condition. Because it can be scary if you start to type in urinary urgency, UTI symptoms, and this pops up, interstitial cystitis. Like you go on those things and it's kind of gloom and doom on the internet a little bit about it. But we've had really high success rates treating this stuff. And so I just really feel like if we get the why is your bladder feeling like it has a UTI all the time? Why do you have that pain? And then sometimes it's 90% muscle, sometimes it's 100% pelvic floor muscle, sometimes it's only 50, 40, but then we can really help to navigate the system and get you to a specialist that really does specialize in it. And we have a ton of resources on our website about like how, if you've been diagnosed or think you have it, like where should you go first step, second step, third step, to make sure you don't sort of get off track by a well-meaning medical professional that just doesn't quite understand all of the things.
Yeah, that's never good.
Deliberately, obviously, gives bad information, but they're, people's knowledge. The people have limits to their knowledge, so even doctors. So it's just really important to get the right information. And just know that if you have IC, there's total hope that all those symptoms can go away or significantly decrease. And so that's the biggest message I can get out to about the condition for sure. So yeah.
Chris just muted himself because the coffee shop dance party in the background.
It's epic. It's epic music. I am getting a few raised eyebrows from some of the stuff I'm talking about, though. So
I bet. Peeing, bladder.
Like, Beth, what were you going to say before my last question?
I was just saying that where my brain was going with all of the core connections is that this is another good reason that I say, hey, on our website, check with your doctor. Even though doctors don't always know, you need to rule out medical conditions for bladder stuff. And while as an exercise scientist, my brain jumped to fitness reasons and muscle reasons and neurological reasons for core and bladder dysfunction, that may not always be the case. And this is why it's important for you listening to not just rely purely on online fitness options like mine, but to actually go see somebody that is a specialist, like Nicole is saying, because they can help walk you through the steps that will truly rule out things that are not a problem and rule in what is the problem so you can get to the root of it. That way you're not wasting time and money chasing phantom things, as she mentioned. Yeah. And you can get better and stronger faster that way.
Totally.
It's very important.
Cut out a lot of unnecessary stuff if you just kind of get to the root of the issue right away. Right?
Right.
So,
right.
Yeah. So there's a big, go ahead.
Oh, I was just going to say that we're all like so excited to talk about this. I was going to say that when I looked this up, it says the cause what are the causes of interstitial cystitis? And it says, while the cause of IC is unknown, there are several theories as to what triggers the condition. Some possible causes include defects in the lining of the urinary bladder that cause irritation, bladder trauma, or overstretching. Now, of course, I zone in on the bladder trauma part because we know that carrying a baby is bladder trauma.
It can be, for sure. So yeah, this is an interesting thing. So it's true that they used to think that IC was a disruption in the lining of the bladder where the actual urine would get in and permeate into the lining of the bladder where the nerves are. Okay. And that's what it feels like to patients, for sure. It feels like that. A lot of people say it feels like there's glass in my bladder. There's that kind of stuff. It can be bad. However, the more that we're actually studying about the condition, we find that actually only about 10% of people with IC actually have physical damage to the lining of the bladder. And that's a subset of IC called people with Hunner's lesions. And so, right. So that's a little bit of a different breed. They still benefit from physical therapy. They still benefit from movement, but that there's an actual bladder lining problem. The other 90%, while it feels exactly like that, it's actually not a huge bladder lining issue. And so, or at least not as much as we once thought that it was. And so that's where some of the we don't know the cause. And therefore, when we talk about, is there a cure for this condition and stuff, it's like, it gets a little bit muddled as well, because if you don't have one identifiable cause, then you can't have an identifiable cure. However, the symptoms can definitely be significantly managed and even go away to be people have symptom free. So that's a hopeful message because there's just not one thing, right? There's a bunch of different factors that go into it. And like you mentioned, bladder trauma can be one of those things. So, and that can be a variety of different ways. Like if the baby was sitting more towards the front, anterior, pressing on the bladder a lot, that can either cause actual trauma or just your brain starts to pee so much more often when you're pregnant that right?
Yeah.
That's just in the nature of pressure in there. But then when the baby comes out, then the bladder is like, cool, I'm just going to keep doing that same thing. Right. So
that same pattern.
Yeah, so it's almost like a brain connection that needs to be, reset and disrupted again. And like we talked a little bit about before, the C-section, right above the pubic bone, usually the C-section scar actually, they move the bladder out of the way, but the bladder is very close to that area too. And in some instances, that can actually cause a little bit of bladder trauma. You're scooting a lot of stuff out of the way, right? So so there can be that, and then that can cause, and then the other thing is that the healing process of the C-section scar goes right over the bladder as well. And so if the bladder doesn't have room to expand, if there's some scar tissue there, if there's some tightness in the abdominal region, if you're not recruiting your core muscles correctly, then that can also perpetuate not even IC, but just urinary urgency, frequency symptoms, maybe even a little bit of pelvic pain right above the C-section scar, which can also lead to the diagnosis of IC, although definitely not causal, like we talked about. So that doesn't necessarily mean that just because you had a C-section, you're going to have those symptoms at all, but it's pretty common to have those that go together.
Okay. Yeah. And that scar impacts so many things. Chris, you had something you wanted to say?
Well, I don't have a decent way to ask it, I don't think. But what's the question I'm trying to figure out how to ask is, it seems like there's a lot of kind of fuzziness and there's a lot of different kind of, causes and potential outcomes and things. But from a practical standpoint, for the woman that's listening to this podcast, like what practically steps should they take if they think they might be struggling with this, other than, obviously they need to go talk to a professional, but like what are the practical things that they should be doing or thinking or, for the average person out there?
Yeah. That's a good question. So, yeah, because not everybody, this condition is more common than people might think. There's about 12 million people in the United States that we think have IC.
Wow.
So it's actually way more common than was once thought. However, that's still not a ton of people. And so, yeah, so if you feel like you might have urinary urgency frequency symptoms, if you feel like there might be a little bit of tightness at the or pain actually in your pubic region, one of the best things to do, and the thing that kills the most birds with one stone, honestly, and we know how important the diaphragm is with the core system, is to do some deep breathing. Obviously, this is after you've done some research and gone to a medical professional, whatever else, to make sure that this is it. But the first thing that we usually talk about in our practice is calming the nervous system and getting your pelvic floor to actually relax in that state. And so one of the ways that we do that, where we can kill a lot of birds with one stone, is actually engage the diaphragm into your practice. So, which means that you can just take belly breaths. I'm sure you guys have talked about this quite a bit.
Oh, all the time.
Right?
That's why I'm smiling. I'm like, this is
yes,
great.
The connection, right? So the cool thing about engaging the diaphragm is that it is, we talk about the different nervous systems, the fight, flight, freeze response, and then the rest and digest. And pee, right? So if you actually engage your diaphragm, you're stimulating the parasympathetic nervous system, which is the rest and relax and digest and chill and don't freak out bladder and that kind of stuff. So, and then that also, because of where the canister is, right, where the diaphragm's on top, the pelvic floor is on the bottom. When you take a deep breath, the pelvic floor actually relaxes as well. And so that can kind of kill a lot of birds with one stone, where if the pelvic floor muscles are actually causing some of that bladder irritation, then the pelvic floor can relax. If you engage your diaphragm, your nervous system can calm down a little bit. So it's not going to give that connection, the urgent connection to pee. So that's one thing. Stretching, like in some yoga poses like happy baby or a deep squat stretch, like kind of some of the stuff that you maybe did before birth, right? Those are some,
and we've got that. We got that on Fit2B. All those opening the pelvis area.
Hip opening. Because there's a lot of hip muscles that actually are pelvic floor muscles. So any hip opening kind of a thing, any deep squat stretch if you don't have near hip issues. Happy baby's another good one, because it doesn't. It
legs up the wall.
Yeah, feet on the wall.
Legs up the wall.
Because the other interesting thing, you guys, is that the bladder actually has some connections to the inner thighs. And so inner thigh tightness, which is kind of some of the reason why if we have to pee, we like cross our legs, right? Because we're trying to stop the flow. So relaxing some of the inner thigh muscles, doing some inner thigh stretches, however that works for the person, that can be really helpful in trying to calm down the bladder. So in the book, The Interstitial Cystitis Solution, we do have some cool stretches that would benefit anybody, like Chris was mentioning, that maybe thinks that they are having like a little bit of a urgent bladder or pain. And so that's where we can really go. But inner thigh, pelvic floor relaxation, breathing, those are great places to start if you think you might have something like this, because that won't hurt anybody. So
that's another thing is, I want to just make sure it's really clear to people that are listening. And if you're a member of Fit2B or you're, already really religious about doing your Kegels and your core work and your transverse and all the things that we do to help bring a core that doesn't feel like it's functioning back online. If you're doing the transverse abdominis work or you're doing your Kegels, but your symptoms are worsening or it's not helping, you're still experiencing urgency, frequency, pain. Pain is always a no-no. Pain is always something that you want to go get checked out, especially when it's very localized. Like she's talking about, it's very local around the pubic bone right above it. or your bladder itself feels like there's glass in it. These are all things to watch for and feel for, and to have that checked out, because like she's saying, what you may need is stretching and relaxation. Hey, there's your excuse to Netflix with legs up the wall, you know, for a few days, right? Maybe not a whole day with your legs up the wall. You know what I'm saying? That might be a little extreme. I have trouble walking after that. But knowing the right thing to do is so beneficial. Again, it's going to save you time. At first, it might be like, I don't have time to go to the doctor. I don't have time to get a test that's going to cost me money. Okay, but if you're not able to exercise and you're living in pain, you are worth spending a little bit of money on
for sure
to take care of, so you don't fall apart, because we need exercise.
Yeah.
So UTI is super, super common, and this other thing is not very common. So I have a suspicion, and I'm curious what you guys think about it. Suspicion is that you have some of these symptoms, you go to the doctor, and the doctor maybe does a test to see if there's an infection, and they're like, it's not showing that there is one, but let's give you some antibiotics anyway, just to be safe. Because I feel like that's actually a really common thing, not to throw the doctor under the bus, but I am going to. Is that true that happens a lot? And if that's the case, should they seek advice of another medical professional before just jumping into the antibiotic train? And because it's massively overprescribed. There's lots of research that shows that. Yes. And what do you think of that?
Yeah. So it's super common for that to happen. And the biggest thing that I tell anybody that goes to their doctor, I really just want everybody to be really good advocates for their own health, and don't be shy to ask your physician the reason why are we prescribing that if there's no evidence of infection. And you can get the prescription filled and not have to take it right this 1 second away, and then maybe
that's a good point.
Yeah, you know, you can do a little bit of research, you can get another opinion, but that it's a very common thing to, and you know what, actually there's a ton of evidence of that happening, actually even more in the male population, with chronic prostatitis, which actually is connected with IC. So a lot of guys will go to their urologist, think that they get diagnosed with chronic prostatitis because they feel like they have a UTI or a prostate infection because it's getting irritated, and then they get prescribed antibiotics. I've had people be on antibiotics rounds for years before anybody talks to them about their core pelvic floor.
Oh my goodness.
So and then you have all kinds of other gut issues on top of that. But so the biggest advice that I could give to people is to be respectfully questioning your physician. If there's no evidence of infection, if you're just doing a dipstick test versus an actual culture, it's okay to ask your doctor about that. And if they can do a really great reason as to why, then you can try, but then also pay attention to, if that doesn't work, let's not continue to do the same thing over and over again.
Right. For sure.
You know, so that's what my best advice would be for that. So, but you're right, it's super common occurrence, especially in somebody that doesn't, you know, in my book, we talk about, you know, when you go to your doctor, they're taught diagnostically to think, when you hear hoofbeats, think horses, not zebras, right? So, right, you looks like a UTI, it smells like a UTI, it is a UTI, here we go, even if my test isn't actually confirming. But a lot of times, while IC is still not a crazy amount of people that have it, it's more common than the physicians were learning that it exists. Yeah. And so we always talk about that IC might actually be the horse and not the zebra, and so we might not want to give.
My guess is because UTI is so common that it's probably underdiagnosed.
Yeah,
IC is massively underdiagnosed. So you've got 12 million cases in the U.S. You said, I think you said 12 million cases annually. So you're like, well, that's a tiny slice of the population, unless it's massively underdiagnosed and it's actually 100 million. Or 80 or something.
Right.
Because a lot of things are misdiagnosed that are like this, where they have very similar symptom profiles. It's just like, oh, this is what it is. And then if they just learn how to deal with it and they take the antibiotics and then it kind of goes away on its own, that was a UTI, solved it. And it might not be the case at all. So I think people need to educate themselves and buy your book and get a different healthcare provider if they're getting crappy answers. That's what I think. That's kind of an aggressive answer.
No, that's
Amen.
usually how I answer things too. I'm being a little bit more diplomatic here. No, but seriously, that is, again, like, you just need to be respectfully questioning, because they just need to do better research, and just make sure too that you're getting like the right research online and stuff like that. From very, very top people in the field, because it can be really confusing, but you don't want to go down a rabbit hole you don't need to go down. And there's a lot of natural solutions too. Like if you're if you have a history of UTIs that involve E. coli, for instance, there's something called D-mannose that you can take that's actually shown to help with decreasing infections in that. And that's just that's an over-the-counter, supplement to take. So there are other options. I mean, obviously you don't want to let a true UTI go rampant because that can affect your kidneys and stuff. But yeah, like, just be questioning about it. And then I would love to dial back to when you were talking, Beth, about Kegling. Can we go back to that? Too?
Yes, please.
Okay.
Yes, please.
So you mentioned before about like Kegling, and so people that have IC, that actually have been diagnosed with IC, that actually have that, Kegling is actually not recommended. However,
Right.
I'm sure that you guys have talked about on your videos and stuff about how you can strengthen the pelvic floor and the core without doing Kegels, right? And you talked about
we're all about that.
I'm sure.
We're all about that.
People know that
I hate Kegels, actually.
Yeah, they don't understand that those two things can coexist. You can still strengthen your core and pelvic floor without over activating what we call a concentric contraction, or a Kegel exercise. So I love that you brought that up, because I think that finding a way, and a good way to do the breath work with the transversus abdominis contraction, to not do over activating the true pelvic floor squeeze muscle,
right?
Especially if you have some of these symptoms, that can be really helpful also. So you can still do a lot of core work, and we coach people to do that too. You can still strengthen your core without over activating the pelvic floor component of it. And so, so I love that you said that and you brought that up, because that's a huge piece of, if you have urgency, frequency of urination, any bladder issues, any bladder pain. Sometimes people are scared to work out and activate their core muscles, but there's a lot of core muscles that have to work coordinated together, and it doesn't have to be, it's not all about the Kegling. So
yeah, let me speak to that for a second, because we have a pelvic floor connections video on Fit2B. There's actually two different versions. One that we filmed with kids in the room. And so I use slightly different language, and it's a little bit different setup. And then one with these same exercises, but no kids in the room, more straight anatomical talk. They're both on the same page for our members on Fit2B. And when I was researching that routine and putting it together, my goal was to have it include all exercises that would move the body and create a natural activation in the pelvic floor without the emphasis on Kegels, because it's already hard enough for me to teach, as much as I love it and I'm really good at it, but to teach through a screen and get people to move appropriately, and to know that my cues are going to move people, and I practice them on real populations to make sure that if the whole group in the room moves the way I just cued them to move and it gets a good result, that's awesome. If half of them were like, what did she just say? That's not a good cue for my videos. And so, but teaching a Kegel, nobody can see that thing move. Nobody knows what's going on there. And a lot of, and I even joke about that a little bit. Like, I can't come around and check this for you, ladies. So, and sometimes people can't feel. Honestly, I have a strong pelvic floor. It's been tested 9 ways to Sunday, but I still have trouble really feeling it sometimes. And so that's also not necessarily a good measure of what's going on. And so We do know, though, that like you said, the inner thighs are connected. Your transverse abdominis is connected. Your breathing is connected. Yep. So by bringing motions that encourage those things into a routine, we know that we're going to activate the pelvic floor without over squeezing the darn thing over and over again.
Right.
And not that Kegels are bad. They're just not my favorite way to work the pelvic floor. A lot of people also miss the part of Kegels that is the relaxation part. And
Yes.
I do teach Kegels in another routine we call basic transverse and Mula Bandha. And then we have a full Mula Bandha where we really activate and focus the pelvic floor during various motions. But I'm careful to say, hey, this is also something that's going to happen naturally if you're doing these other pieces. So even if you don't feel it, trust that it is happening on some level. You're going through these motions. Your body can't help but do its thing, unless it's severely dysfunctional. And if you notice an increase in symptoms while you're doing this thing, that is when you need to go talk to a PT.
Yeah,
and I say that in just about every video we have,
which is so
because we can, especially as women, but also guys, we're like, well, something kind of hurts, doesn't feel right, but the rest of me's fine. And I like what I'm doing. So I'm just going to ignore it for a few more days.
Right. Right. Nope.
And that's not good. We need to not ignore peeing the pants. We need to not ignore bladder pain. We need to not ignore the pains that are down there, because those are big red flags.
Yeah.
Big red flags.
Yeah. But then I'm all about, I'm kind of off the Kegel train also, but I feel like people that have like interstitial cystitis for sure, and then other like hypertonic pelvic floor conditions are always so scared to activate their pelvic floors. And we, as long as it's done in the correct manner with the correct, breathing and coordination and stuff, it's okay. It just needs to be, like you said, it just needs to be, you just need to monitor your symptoms, or if some other weird symptom comes up, like you could be totally fine to go through, some, that video, for instance. And if all of a sudden you're like, oh my gosh, I'm like rushing to the bathroom like a lot more, than it's like, ooh, you might have been hovering right on the edge of a little bit of a problem. And then you just got to address it, and you can go right back to activating that area. You just got to figure out, I always talk about figuring out the why. Why is that symptom coming up for you? And so you got to figure out the root problem. But so I love that you guys talk about that. And I think it's really important for people to understand, not be scared to activate.
Yeah, we talk about all that stuff on Fit2B.
So Nicole, as we're kind of wrapping things up, I know that there's going to be people that are listening to this that are like, oh man, maybe that's me, but small percentage is probably not me. What would be your 30-second advice to like the woman that's listening to this, standing in the grocery aisle, you bump into her and she asks you, or I don't know, like what would be the practical next steps they should take if they think this might be something they're dealing with, or they know somebody who might be dealing with it? What would you say to them?
Yeah, I would, that's a really good question. I would say to them, to make sure you get like a reputable resource to sort of check off the boxes. If you might think you might have IC or bladder pain, there's a couple of other things that it can be too. Overactive bladder, which is a urgency frequency without pain. There's just regular urgency of urination, like maybe your brain bladder connection is a little bit off. So we talk about, to do a little bit of a selfless plug, I mean, my book is pretty good at, even though it's called the Interstitial Cystitis Solution, it does talk a lot about what things aren't IC and what things are IC, and that pelvic floor connection to bladder dysfunction in general. So that's a good place to start.
Awesome.
And if you have IC or you've been diagnosed with it, then the first places to go are the Interstitial Cystitis Association also has really good information. There's another thing called the Interstitial Cystitis Network, 2 organizations that also go through, do you have it or do you not have it type of a thing. And so, and the biggest advice that I would give is to have people not be scared if at the diagnosis and not be scared of the symptoms, because the pelvic floor and the core can be so connected with that it doesn't have to be a scary medical diagnosis that you get, that you just need to get the right medical team involved, which usually includes a pelvic health PT, a good doctor that's used to treating it, and then make sure you keep moving and get coaching back into that, into overall just better health and movement of your pelvic area. So. But
the
main thing is education. Don't let the fear cause you to not do anything, to take action.
Right.
Absolutely.
So I love that. So we'll put links in the show notes, but so the book, is that available on Amazon?
Yeah, the book's available on Amazon and or anywhere books are sold online, Barnes & Noble, whatever. Amazon's usually the best one. And and then my website.
Then what about your website? Yeah.
Too. So I have pelvicsanity.com. It has a lot of information. We actually have a pelvic floor screening dysfunction protocol on there. So you can take a little 10
That's awesome. I saw that.
It's a 10 question test. If you answer yes to 3 or more of those symptoms, then, pelvic floor dysfunction might be likely, and that you might want to think about getting a pelvic health physical therapist on board, to help you discern which symptoms are coming from muscles and maybe which ones aren't. So that's a really cool test to take also. And then again, just get good reputable information. Don't be scared, and then to keep moving, because as we said,
keep moving.
The core stuff is really important for all pelvic health and stuff. And so we need to make sure that we're not scared to move, and we can't be scared of our symptoms. So don't let the fear stop you.
Right.
And I would add about that test. The other day I caught myself thinking, because I saw a post you had about that test, and I thought, I don't need that. I don't have that. But the reality is we can develop core dysfunction, pelvic floor dysfunction anytime. We can resolve one thing and then go through a stressful scenario, whether that's a physically stressful scenario or an emotionally stressful scenario.
Yes.
You spend a week yelling at your kids, that's going to affect your pelvic floor.
Totally.
I have had a week like that. I've had a week like that where there's been missing school assignments and naughty language and soap washing out of mouths. And, so there's been some extra stressors. And I think, I probably need to take that test again because I'm noticing a couple things and maybe my answers will have changed. And I want to be on top of that. I don't want to sit over here going, oh no, I don't have a problem. I'm a professional too, so I surely don't have a problem. That is when we can really hurt ourselves by turning a blind eye. And so I'm going to be taking that test.
Yeah, perfect. You do it.
That's a good point. Well, Nicole, thank you so much for spending time with us today. It's been super good and informative. Like I mentioned, we'll put some things in the show notes and link to your book and so forth, but it's been really fantastic. Thank you for carving out some time with us. I really appreciate that.
No problem, my guys. Thank you guys so much for all that you guys do on your podcast and your program or your fitness stuff. And then just for raising awareness. So it's really just wonderful. Thank you.
You're welcome. Thanks for being on. Talk to you later.
Okay, bye.
Okay, friends and fans, if our podcast floats your goat, you should subscribe to Fit2B Radio and also follow us on Twitter at Fit2B, on Instagram at Fit2B Studio, and on Facebook via Fit2B Tummy Safe Fitness. That's my rooster. I'd also love for you to join Fit2B.com so you can work out with me. Plus, that's how we pay our bills that keep our lights on, providing family-friendly workouts that help you make a strategic return to fitness. See you there.